Hello everybody and welcome back to another radiology anatomy tutorial. Today we're going to cover the abdominal aorta and its branches in some detail. Now I know for some of you learning vasculature is just a little bit boring or a little bit tedious, but this anatomy here is so clinically relevant and it comes up over and over and over again in exams. So if you're someone who's writing exams, this is such a high yield topic. I'm going to take each of the major branches one by one, and we're going to take our time through it and go through systematically the various branches off of those branches and then follow those arteries all the way down to the end organs. Now you may have seen a diagram like this before, and what I find really difficult, especially with abdominal vasculature, is that we have this straight aorta coming down through the abdomen, but all our organs have rotated around one another and the vessels have rotated with those organs. It can be a little bit confusing as to where the vessels originate as opposed to where they actually end up. So what I want to do today is, before going through the CT scan, before going through each of the major branches, I want to just draw where the major branches go, and then we'll have some understanding before we head into the CT scan. Now if we have a look at this image, let's just get our bearings and label the arteries that are coming off. The abdominal aorta comes into the abdomen at the level of T12 through the diaphragm and gives off these inferior phrenic arteries, which are often very difficult to see on a CT scan. Then our first major unpaired branch is our celiac trunk. Next to that, or just below that, we have these small suprarenal branches going towards our adrenal glands. And you may notice these small vessels coming back here. Those are our lumbar arteries from the posterior portion of the aorta, heading back towards the psoas and the quadratus muscles, as well as the vertebrae themselves. Then our next big branch is our superior mesenteric artery, and that's going to supply blood to our midgut. Below that, we've got our paired renal arteries coming out the side. We have small gonadal arteries quite high up on the abdominal aorta, and that's just a remnant of where our gonads developed embryologically before descending down into the pelvis or into the scrotum. And then lastly, our major branch off the front is our IMA, our inferior mesenteric artery. And then as we bifurcate into our common iliacs, we have this small artery coming off called our median sacral artery, and we're going to cover that. So as I've said, let's have a look at an overlaid image with our internal abdominal organs and then see where these branches take us. So here we can see the abdominal aorta coming into the abdomen, our esophagus just there to the left of it. Our patient's left is here now and the patient's right is here. We can see our liver on this side. Our first major branch here is our celiac trunk, and in this diagram it bifurcates before bifurcating again, but often it trifurcates there. The first branch of that trifurcation being here, our left gastric artery, which is going to supply the superior portion of the stomach. It's going to supply that lesser curvature of the stomach here, you can see. Then we have our splenic artery, which will run posteriorly to the stomach, and it's this really tortuous artery, as you'll see just now. And that tortuous splenic artery heads its way off to the spleen. Along the way, it sends some branches down to the pancreas, pancreatic branches, and it gives off some short gastric branches into the stomach itself. Obviously, it supplies blood to the spleen, and it gives off a large branch here, which is our left gastroepiploic branch, and that is supplying blood to that greater curvature of the stomach there on the left. Then our last branch off the celiac trunk is our common hepatic artery here. And the first small branch coming off the common hepatic is our right gastric artery here, which is going to supply the other side of the lesser curvature of the stomach. So you can see now we're covering both sides of that lesser curvature of the stomach. It's still common hepatic artery, and it gives off a gastroduodenal branch that dives down into the abdomen. We'll see that nicely on our CT scan. That gastroduodenal branch gives off a small branch here, or a couple branches, to the superior pancreatoduodenal artery. This is our superior pancreatoduodenal artery, and then gives off a longer branch, which is our right gastroepiploic artery. So we've got our right gastroepiploic artery supplying the greater curvature of the stomach, coming from our gastroduodenal artery, and our left gastroepiploic artery coming off the splenic artery, supplying the other side of our greater curvature of the stomach. Once our gastroduodenal artery has branched off of our common hepatic artery, the artery then is known as the proper hepatic artery. And this has a right hepatic artery branching off and a left hepatic artery, with this right hepatic artery giving off a small little cystic artery that's going to go to the gallbladder. So now we've got our orientation. Let's have a look at what it looks like on axial slices in the CT scan. We have an axial CT here. You can see that we're in the thorax currently. You can see the heart here. We can see our descending thoracic aorta on the left-hand side here posteriorly. We want to follow that down. We can see anterior to that, we have our esophagus here. You can see a small bit of air within the esophagus. And the esophagus pierces the diaphragm at about the level of T10 and heads into the stomach there. You can see the esophagus going down like that. And you can see why, if we have gastroesophageal reflux, that esophagus is right next to the heart here. So you can see why reflux can present as a centralized, almost cardiac chest pain, quite hard to differentiate. We see that esophagus diving down into the abdomen there, and then slightly lower down at the level of T12, our abdominal aorta is starting. That's going through the diaphragm here. We can see our azygous vein coming up on the right-hand side, and our abdominal aorta now piercing the diaphragm before giving off those major branches. So you can see our first branch here, which is going to be our celiac trunk that we've just covered. It heads anteriorly before giving off that first branch, that left gastric artery supplying that lesser curvature of the stomach. We head further along, we can see it then gives off its second branch, or in the trifurcation, which is our splenic artery. You see how tortuous the splenic artery is all the way out to the spleen. Now that splenic artery we can see is above the pancreas here, so it's going to send pancreatic branches down to the pancreas. And you can see in what close proximity it is here to the stomach, so it's also going to send short gastric arteries coming off. And then we can see this long artery heading all the way around, which is our left gastroepiploic artery supplying the greater curvature of the stomach there. It's going to descend down in the left-hand side of this patient here. Let's go back up to where the splenic artery came off. We know that the other branch here is called our common hepatic artery. We can see that heading off towards the liver itself. So this is our common hepatic artery, and in this case, the hepatic artery breaks off to our gastroduodenal artery first. We can see it dive down there. You see how it dives down like that. We can see our pancreas here and our inferior vena cava here, and as we come down, we follow it, it then gives off this small branch, which is our right gastric artery. And a lot of this anatomy is variable amongst patients. So here our right gastric artery is coming off our gastroduodenal and not off the common hepatic itself, but we can still see it there. And then we can see a small branch coming off here, going backwards, and that is our superior pancreatoduodenal artery that we looked at in our diagram, supplying the duodenum and the pancreatic head there. We can follow that gastroduodenal artery all the way down. Let's follow it. It takes a long course, and we know that that terminates in our right gastroepiploic artery, going around the stomach there, supplying the rest of the greater curvature of the stomach. Let's follow that gastroduodenal artery back up to our common hepatic artery. Here's our common hepatic artery. There's a short section here, which is our proper hepatic artery, and that proper hepatic artery branches into our right hepatic and our left hepatic arteries there. You see our left coming off and our right going off there. Now if we look closely on the right, we scroll down inferiorly, we can see there a small cystic artery heading towards our gallbladder. So it's a bit confusing, but you just go through it slowly, methodically, looking for initially the trifurcation and then those branches off of the trifurcation. Let's have a look at our celiac artery in coronal plane here. We've got beautiful images here where we can see all these branches. Get our orientation. We can see our abdominal aorta coming here through the diaphragm. The patient's right is here, the liver, and their spleen is here. As we head more anteriorly, we should see the branches. We can see our renal arteries coming off there. We can see our celiac trunk, the most superior branch, and we can see our superior mesenteric artery coming here. So let's look at our celiac trunk. We can know that this is our left gastric, the first branch coming off there, supplying that lesser curvature of the stomach. Our really tortuous splenic artery going out towards the spleen. Now we know that this is our common hepatic artery coming across, giving off here a really small right gastric artery that's going to go to that lesser curvature of the stomach. We head out laterally following this artery. It plunges down, giving us our gastroduodenal artery here. Once that gastroduodenal artery has come off, this is called the proper hepatic artery. And our proper hepatic artery bifurcates, as we know, into right hepatic artery and left hepatic artery. That gastroduodenal artery will then give off some superior pancreatoduodenal arteries, as well as heading all the way around, giving us our right gastroepiploic artery. Now, with each of the major arteries, I want to show you a DSA because it's a common way for us to assess these arteries, and this also comes up. These questions come up in exams all the time. can see our diaphragms here, our patient's liver is on the right, and our cannula is coming in here, injecting contrast into that artery. This has actually gone into our common hepatic artery. We can see some contrast heading off into the splenic artery, but here's our common hepatic artery giving off our gastroduodenal. It's now our proper hepatic artery going to our right and our left hepatic arteries, as well as our gastroduodenal giving off our superior pancreatoduodenal arteries, as well as coursing all the way around to the greater curvature of the stomach as our right gastroepiploic artery. Okay, so I've spent most of the time of this talk is going to be on the celiac artery. Now we're going to cover the SMA, and they get easier as we go along because the complexity gets less as we go down. So again, let's have a look at what our SMA does. I've headed a little bit further down in this diagram. We can see our celiac trunk at the top here, and this image probably exaggerates how far the celiac trunk and the SMA are. They're actually really close together. But anyway, our SMA is going to come out, and the first branch that our SMA is going to give is going to be going to the pancreas and to the duodenum, and this is our inferior pancreatoduodenal artery. Then we know that our SMA supplies our midgut, so we know it's going to need to supply blood to the jejunum. So it's got jejunal branches going off, it's got ileal branches as well, and then it heads off to a terminal branch here. If we were to follow that SMA all the way down, we can see our ileocolic artery coming down. We need to then supply our ascending colon, and that's our right colic artery. He's going to give off blood to that ascending colon. And then we have a middle colic artery supplying blood to those first 2/3 of our transverse colon. Now, when we scroll through the CT scan, I'll show you this inferior pancreatoduodenal artery. Then we will look at all the arteries on the left-hand side of the patient, head back up to the top, and look at the arteries on the right-hand side of the patient, just so we can get our orientation here. So let's have a look at the CT scan. I'm going to scroll all the way up. Let's find our celiac trunk first. I'm going to show you how close the celiac trunk is there to the SMA there, so you can see how you can easily get these confused. Now, if you're ever looking at just a single slice, say an exam, you can't scroll through, there's some good landmarks to figure out where the SMA is. Now we see as the SMA comes off, it goes over this structure here, and this is actually our left renal vein. Our left renal vein needs to come in front of the aorta, behind the SMA before going to the IVC. You see our right renal vein doesn't need to cross the midline, but our left renal vein goes across like that. And our SMA, if the angle between the SMA and the aorta is too sharp and there's a lack of visceral fat here that's helping that SMA to stay off of that left renal vein, we can actually get pressure on that left renal vein. That's what's known as nutcracker syndrome. And we get venous hypertension in that left kidney. We can get macroscopic or microscopic hematuria and ultimately renal damage, kidney failure. So that's something that we need to look at clinically. Is there enough space allowing for that left renal vein to come through? And as we scroll down further, we can also see that the duodenum is going to come across here. And if the SMA was to impinge the duodenum, that's what's known as superior mesenteric artery syndrome. So let's follow that SMA off of the aorta. We see that it goes behind the pancreas here, the uncinate process coming around the SMA. And we know that just inferior to the pancreas, we're going to give off branches out. Inferior pancreatoduodenal arteries coming here. Head further on, we should now see branches coming off to the patient's left, supplying the jejunum and the ileum. So let's see the jejunal branches coming off there, going towards the jejunum. As we head down further, we see ileal branches going down. And if we to follow this artery all the way down, we can see our ileocolic artery going all the way to the cecum. Let's head our way back up right to where the SMA comes off of the abdominal aorta. And we know that on the patient's right-hand side, there needs to be a middle colic artery supplying the transverse colon. So let's have a look for that. We pass the inferior pancreatoduodenal arteries, and we should look for a slightly bigger branch than usual coming off there to the patient's right. Follow that branch. We can see that it's supplying the transverse colon there. It's supplying the proximal 2/3 of the transverse colon. So we can see that branch there. Let's head a little bit more inferiorly, and we should see our right colic artery coming off. There's our right colic. We can follow it along. Let's see, it should jump across to the right. There we go. And it's supplying our ascending colon on the right-hand side of the patient there. Perfect. Let's have a look at what that looks like on a DSA. So again, we're injecting contrast into our SMA here. Our catheter tip is just past our inferior pancreatoduodenal arteries, so we're not going to see that. The first branches we're going to see off are our jejunal branches going to the jejunum, then our ileal branches, then the terminal branch coming as our ileocolic artery. On the patient's right-hand side, we've got our right colic artery, and then we've got our middle colic supplying this transverse colon, 2/3 of that transverse colon with blood. The last major branch that we're going to look at is our IMA, our inferior mesenteric artery. Again, we've come a bit further down on this diagram, and our IMA comes down quite inferiorly at about the level of L3, and it gives off firstly our left colic artery. And I've drawn it like this because it supplies that distal third of the transverse colon as well as this descending colon, and actually these arteries anastomose. So there's an anastomotic artery that runs all the way along here that's known as the marginal artery of Drummond. And so that if we were to occlude one of these vessels, there's a lot of collateral supply that will allow the tissue there to receive blood and not become ischemic. We then give off sigmoidal branches to our sigmoid colon, and this IMA then has a terminal branch, which is our superior rectal artery, supplying blood to that superior or the proximal portion of the rectum there. Now this marginal artery of Drummond is here, and there's little vessels that actually go into the colon. Those are known as our vasa recta. So let's have a look at what it looks like on a CT scan. We're going to start by finding our superior mesenteric artery. So there's celiac, superior mesenteric. We should see our right and our left renal arteries heading off towards the kidneys there. And as we head down, we'll see a smaller branch. It's much smaller than the celiac or the SMA. We should see a smaller branch coming off just over the anterior and left-hand side here coming out. There we go. We can see it there. Now that's going to give us a left colic artery first. So let's have a look for that left colic artery. There we can see a left colic going towards our descending colon. As we head down further, we should see branches there coming off to our sigmoid colon, and then we can follow that right the way down, and this artery here should become our superior rectal artery, supplying blood to that superior portion of the rectum there. Perfect. Let's have a look at a DSA of the inferior mesenteric artery. Again, it's best to look at it in a CT and in terms of this 2D image so you can really understand where these structures are. But as always, when we look at a DSA, the patient's left is here and the patient's right is here, similar to a CT scan. So our catheter tip runs all the way here into our IMA. We can see our left colic being given off here. And if we scroll through a little bit, we can see this marginal artery of Drummond there, and it's going to actually supply our transverse colon above as well. Then we're giving off sigmoidal branches to the sigmoid colon. And finally, looking down here to our terminal branch, which is our superior rectal artery. Before we end off, I just wanted to show you a couple of arteries that we haven't mentioned, much smaller branches coming off of the abdominal aorta. Now, we can't see our inferior phrenic arteries here, and we also can't see our suprarenal arteries, but our suprarenal arteries are going to come to these structures here, which are our adrenal glands. We can see our adrenal glands there, both limbs of the adrenal gland. That's something, if you're looking at CT scans for the first time, it's quite difficult to see, but you must get used to looking for those adrenal glands. As we head down, you'll see that posteriorly there are arteries coming off the back of the aorta here, heading medial to our psoas muscles and our quadratus lumborum muscles, and those are our lumbar arteries that are supplying blood to these posterior, these retroperitoneal muscles, as well as our vertebra and our intervertebral discs. We can head down further and let's get our bearings here. We can find our IMA. Now above our IMA, but below our renal arteries, if we look carefully, we might see branching off a gonadal artery. So there, perhaps on the patient's left-hand side, is a gonadal artery. They're often very small and often can't see them. And they run on the anterior aspect here of the psoas muscle all the way down into the pelvis. And that's a remnant of the descent of our gonads as we are developing in utero. And that gonadal artery in men will go through the inguinal canal before heading towards the testes. Finally, I want to end off at the bifurcation of the abdominal aorta that happens at the level of L4. And as we saw in that first diagram, there should be a small artery. It comes off posteriorly, supplying the sacrum. This is our median sacral artery. Can you see it there? It's a very small artery. We can follow that median sacral artery down into the pelvis. and those are going to supply our sacrum as well as sometimes giving off a little bit to our superior rectum. So I hope that helps. I'm going to link this playlist down below. It's a Radiopaedia playlist where you can actually go through these very images and scroll through, follow the vessels yourself. And at the end of this playlist, I've linked a beautiful illustration here by Dr. Michael Hartung, who's gone ahead and color-coded all of this and labeled a lot of it. It doesn't always follow the vessels all the way down, but it gives you a great idea both in the coronal and in the axial planes of where to go. And as with all things like this, it's repetition, repetition, repetition. Get comfortable with following the arteries. Look for normal anatomical variants. Make sure that the arteries are patent and the tissues that they're supplying look normal to you. So I hope this has helped you kind of gain some form of 3D understanding of how these vessels course through the abdomen. It is a difficult topic, but again, it's so clinically important and it comes up in exams without fail. It's hard to have an anatomy exam that involves the abdomen without being asked these questions. Let me know what other anatomy you would like me to cover in future videos, and until next time, I'll see you all. Goodbye.